The fungus known as Candida auris is a type of yeast that is not a problem for healthy people, but can be dangerous, even deadly, for patients with underlying conditions. With the first case of the state now confirmed, healthcare officials are warning hospitals to keep watch.
I think it was only a matter of time before we'd see our first case.
Nigel Turner is the director of communicable disease control for Tacoma Pierce County Health. The department released a notice in July stating a Pierce County man was diagnosed with Candida auris colonization on July 13th. Patients who are colonized with the fungus are not necessarily infected, but can carry and spread it, even though it doesn't make them sick.
We're absolutely investigating. That's the work that's ahead of us, is to provide, testing for in the hospital and any sites where people might have been, that to see what's the scale of this and the scope of it.
Candida auris is a type of yeast the CDC calls a serious global health threat because of its resistance to multiple antimicrobial drugs. First detected in 2009, it has spread to levels that have alarmed healthcare facilities.
So over time, as Candida auris has been exposed to different antibiotics or antifungal agents, in the course of treating someone for their critical illness, it can evolve resistance.
Dr. Alora Carmarker is an infectious disease fellow at UW Medicine. She treated Candida auris patients during a breakout in California years ago and points out it can be deadly if a patient with the fungus presents certain symptoms.
The challenge with those symptoms is they're very nonspecific. So if someone has sepsis or if someone has pneumonia, it doesn't necessarily mean it's from Candida auris. People who have a bacterial infection can get sepsis or pneumonia.
Candida auris was confirmed from the Pierce County patient when he was discharged from St. Joseph Medical Center in Tacoma to Kindred Hospital, Seattle First Hill, though it's unclear where the patient first acquired it.
This was a standard screening process at the facility in King County. So this is the system working to find this and then allow us to trace it back and see what we can find and again put in place measures to prevent further transmission.
It's really not a risk to the general public. It is a risk to people who are already very sick.
Marissa DeAngeli is a medical epidemiologist for the Washington Department of Health. She points to the Partners for Patient Safety program that regularly screens for Candida auris, a program that Kindred Hospital is a part of.
Because if it hadn't been identified there was potential for spread on throughout the state.
DeAngeli says as of this week, screenings have shown no new cases of the fungus in Washington. Healthcare officials also urge anyone who visits patients at healthcare settings be aware of infection control practices to help prevent potential spread. For HealthLink, I'm Christine Pei.